Hello everyone, this is Dr. Chandan from Aikya Fertility, the scientific director here. Uh, Today I'm going to discuss about the male infertility. Uh, I have been observed, it's been 13 to 14 years of my experience where I have observed a lot of changes in the male infertility which is happening in this 14 years of my experience. Initially, when I started a career, getting a good quality embryos was not a big challenge for us. But nowadays, when it comes to an IVF, our prime concern is to get a good quality of embryos. That's what we actually think into when a patient comes into for an IVF procedure. But why is that shift? It's a big shift which has happened. There was an article in Times of India post COVID where the infertility ratio initially, when the COVID has come in the initial stage, there was no much study about how it affect the infertility. But later, when there was enough evidence and when enough data was there, so the Times of India, there was an article which says that the infertility ratio, the COVID has impacted on the infertility ratio also. Even we have personally observed that post-COVID, the embryo quality of the patient and their pregnancy rate, success, everything is like totally different before, post-COVID and pre-COVID. So when it comes to male fertility, what best we can do, because sperm is like you can just get it in the lab and do whatever you want, because the sperms are millions in number, but you don't find millions of oocyte when we treat a woman for a IVF procedure. We don't get millions of oocyte. But when we have millions of sperm, there are some certain advanced procedure where we can select the best quality sperm. Say for example, you have a MAC, which we call it as magnetic cell sorter, where you can select the best newly formed sperm, and apart from that you have a microfluidic assay. So there are different protocols where we have to select the best quality sperm. So our prime concern as an embryology point of view is to provide a best quality of an embryo, which are not only by look wise they are good, how genetically they are very stable. It's what our prime concern. So to achieve this best quality embryo which are genetically stable, that which in turns can lead into a live birth rate, we have certain SOPs on patients where any patients who comes for an IVF procedure, we analyze their report completely and go through what are the best treatment can be structurally formed for this particular patient. So it's all kind of a tailor-made treatment for all the patients where we'll analyze what was their history, what was the previous quality of embryos which they had, what was the issue with respect to the male factor, what are the best treatment can be opted for this particular patient. All this tailor-made treatment made us to give last month we had almost 70% pregnancy rate in our center. This is all because we customize the treatment with respect to the patient's previous history. So when it comes to male fertility, especially when it comes to an embryology point of view, it is important for us, before we take up any IVF cases, we go through what is the sperm parameters. Say for example, their count, what was their DFI, what was their previous quality embryos which is formed, what is the reason which has resulted them for a negative success in their previous IVF cycle. We analyze all this basic detail, and as an embryology point of view, as a clinical point of view, we sit and discuss what is the best tailor-made treatment which can be opted for this particular patient, and then accordingly those treatment is provided in our center. So probably I think this is the importance of a clinical team and the embryology team both put together. I always call it as a coin with like you have a coin with two faces. If one face doesn't have anything, so the coin doesn't have its own value. So clinical team and the embryology team both are important for a successful IVF pregnancy, which in turn helps the patient. So this is what I want to convey for you people for in this short information. Thank you so much. Please visit us for your successful IVF pregnancy. Thank you so much.